and let people, thank you, Jess, slowly join in. So good morning, my name is Christy Allen. I am a Knowledge Translation and Implementation Coordinator with the Waypoint Research Institute, and I am excited to welcome you to our last April session of our Waypoint Talks series. So today our focus is on the future of IPV research, and we're hoping this will be an interactive discussion on gaps and next steps. We'd like to start with a land acknowledgement. The Waypoint Research Institute is located on the traditional territory of the Anishinaabe, which include the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy, the Haudenosaunee, Six Nations Mohawk of the Watau community, Huron, Wendat, and Métis peoples. We acknowledge and affirm our commitment to improving relationships between nations and to improving equity for Indigenous communities residing in the central north region of Ontario. So welcome to Waypoint Talks. Waypoint Talks is a virtual webinar series hosted by the Waypoint Research Institute, where we aim to highlight the practical implications of research projects. We also have a complementary series around building your research toolkit, where we aim to highlight best practices used in mental health research, quality improvement, and program implementation. And these events are open to all who are interested in learning more about emerging research, best practices, and clinical innovation. Some quick housekeeping notes. Waypoint Talks is hosted as a Zoom webinar, so please use the chat box and Q&A function to connect with speakers and fellow attendees. And we do hope that some of this event will be a bit more interactive, so we'll explain how we hope to achieve that once we get there. And there will be dedicated time at the end of the presentation for questions and discussion as well. The recordings and slides will be available post-event on the Waypoint Research Institute website, and that will include all the recordings for the last 3 events as well. So stay tuned for those. We also ask that you complete our post-event survey to share your feedback and help improve our future Waypoint Talks events. And lastly, attendance certificates for professional development are available, and we'll share how to access those at the end of the presentation. So I'm really excited to welcome today's speakers. First, I'd like to welcome Dr. Zoe Hilton. Dr. Hilton is the Research Chair in Forensic Mental Health at Waypoint, Professor of Psychiatry in the Temerty Faculty of Medicine, and Professor in the Dalla Lana School of Public Health at the University of Toronto. She is also a Fellow of the Canadian Psychological Association. Since joining Waypoint 35 years ago, she has been both a frontline clinician and a full-time researcher. Dr. Hilton was the lead of the research team that created the Ontario Domestic Assault Risk Assessment ODARA program, and she is currently leading projects on validating the ODARA for understudied populations, risk factors, and outcomes. So welcome, Dr. Hilton. I'm realizing there's also a mistake on the names here, so I will adjust those as I'm talking, but we're excited to welcome Jaden Chong as well. She's a graduate student completing her master's in the Design for Health program at OCAD University. She's completed her undergraduate degree in biomedical sciences at Toronto Metropolitan University and has completed a certificate program with the University of British Columbia in biomedical visualization and communication. Jaden is very passionate about finding ways to integrate design within the healthcare space, and her research interests include health design, knowledge mobilization, and arts-based research. We also have Nikoo joining us today. Apologies, Nikoo, that there's a little mix-up with your name there. So Nikoo is a medical student at Queen's University who is passionate about the intersection of healthcare, innovation, and design. She has led previous initiatives for women's empowerment, like the Project Empowerment Circle, and chronic health management, like Protagonist Health. She completed her undergraduate and master's at McMaster University with a focus on psychology and biochemistry. So thank you for joining us this morning. Lastly, we have Benjamin Presta. Ben joined the WRI in 2024 as a research analyst, and he's currently working on a project aiming to connect researchers and the public to understand coercive control in intimate partner violence and subsequently identify and address gaps for future research. Outside of Waypoint, Ben graduated with his BSc from McMaster University in 2024 and is currently attending Carleton University for his MA. And we also have support from Ashley Melvin and Elnaz Mohini. So I will pass it over to you folks. Thank you for joining us this morning.
Thank you, Christy, for the introductions. It's a pleasure to be part of this Waypoint Talks series. So thank you, Dr. McGeevy, for the invitation to be part of this series. And of course, thanks to the Waypoint Talks team for the support in the background here. So I'm Zoe Hilton, and I'm here with Ben Presta today to talk about an ongoing project about coercive control. What is it, and how do we deal with it? In this project, we're identifying priorities for research on coercive control in Canada, and we'd really like to have your feedback on what these priorities should be. I'd like to start with an acknowledgement. The World Health Organization has found that 1 out of every 3 women globally has experienced violence in their lifetime. And that includes physical or sexual violence by an intimate partner or sexual violence from a non-partner. That number, 1 in 3, has been steady over the past decade. It's not been going down. And also 1 in 4 men has experienced violence in their lifetime too. Coercive control is often related to intimate partner violence. So we acknowledge that many of you who are attending this talk might have lived experience with coercive control. And we understand that our presentation may bring to mind some personal experiences and that these reminders may be uncomfortable or distressing for you. Please do take a moment away from the talk if you need a break for your well-being. We're glad you've joined us today, and we value your input into the discussion that we hope to have at the end of this talk about the research priorities. So our project is about what is coercive control. So I'd like to share some general understandings of what coercive control involves. Evan Stark was one of the first people to use this phrase in the context of intimate partner violence. In his 2007 book, Stark described a pattern of controlling behaviors that people use against their partners. And this pattern is similar to hostage-taking tactics or prisoner of war tactics. And over time, this behavior coerces the partner into staying in the relationship and undermines their ability to leave or even to trust their own perceptions of what is happening to them. Crossman and Hardesty interviewed women who survived experiences of coercive control, and they described 2 ways that it made women feel constrained in their relationships. One way was directly through the force of coercion and intimidation that their partners systematically used against them. Another way was more indirect, and this was to do with how their partners made use of socially accepted gender roles in relationships and how the women felt constrained through their commitment to uphold cultural expectations and relationships. So it's clear then that coercive control doesn't have to be physically violent, even though it can happen alongside intimate partner violence in this context of social expectations of gender roles and roles in relationships. So here are some of the behaviors that are often understood to be part of coercive control. Economic abuse, so that includes preventing the partner from working or controlling all the money. Isolation includes not letting the partner see their family or friends or other people. Intimidation can include making threats of physical violence or other kinds of harms to the partner. Sexual abuse, emotional abuse, harassment, victim blaming can be telling the partner that everything is their fault, including the abuse. Threatening others, so the partner might threaten to hurt the children or someone else that the partner cares about if the partner doesn't do what is being demanded of them. And using male privilege. This captures the idea that coercive control is often used by men against women in heterosexual relationships. They're taking advantage of their greater economic or social status or the rights that men may traditionally expect to have in their relationships. And this also reflects that experience that Crossman and Hardesty showed among women who felt constrained through their commitment to their roles in their relationship. And there are many more behaviors and tactics that have been considered to be part of coercive control. But let me say a little more about this theory that coercive control is about using male privilege in straight relationships. So here we have some of the ways that coercive control can show up in the relationships of individuals with gender minority and sexual minority identities. Identity abuse includes demeaning the person based on the personal characteristics related to their gender or sexual identity. Other forms of abuse include threatening to out the person, telling them to act straight, or belittling the gender they identify with. Deliberate misgendering and deliberate dead naming refer to intentionally using the person's pronouns related to their sex at birth or using the name that they were given at birth instead of the pronouns and name that they identify with. Controlling hormone use and pressuring the partner to detransition. These are other forms of coercive control that can happen to gender minority individuals in their relationships. So coercive control is not limited to using male privilege in heterosexual relationships, but perhaps you can see that it's a very broad concept that it can include a lot of behaviors. Now, doing some of these behaviors once or twice or unintentionally, this might not constitute coercive control. In fact, coercive control is often understood in terms of the intentions of the person who perpetrates it and the effects on the partners who were targeted by it. Now, Canada is on its way to making coercive control a criminal offense, and the offense includes all of these elements: intention, effect, and specific behaviors. Bill C-322 has passed its third reading in Parliament. And so here's a summary of the legislation. First, everyone commits an offense who engages in a pattern of conduct with intent to cause their intimate partner to believe their safety is threatened. And second, a pattern of conduct is required. And this is defined as any combination or any repeated instances of a list of different kinds of acts. And these acts can include threats of violence to the partner, to a child, or to another person, or threats of violence to an animal, such as a beloved pet, coercing sexual activity, controlling the partner's actions, how they care for their children, how their work or school activities, their finances, their gender expression, even trying to control what they think and believe. And also threatening self-harm as a way to coerce the partner into doing something or staying in the relationship. This is also recognized as coercive control in the proposed law. So this definition of coercive control doesn't just consist of a list of behaviors that anyone can easily look at and see, oh, this happened or that happened. It also requires the intent in perpetration and an effect on the survivor. That's a lot harder for somebody standing on the outside of a relationship, like police officers, for example. It's a lot harder for them to be able to detect and respond to than a specific behavior. And that is the reason that we are asking these questions as researchers about what is coercive control and how do we respond to it? And what are the priorities for research on coercive control in Canada to ensure that coercive control is addressed carefully by researchers and that coercive control is responded to appropriately in practice. We need to ensure that both practitioners and researchers understand coercive control, what it is, how it looks, and how it affects people. So over to Ben now to tell you about our project.
Thank you, Zoe. So with that research need in mind, we've set out on a project with four main objectives. The first of which is to enhance knowledge and understanding of coercive control and related constructs. So that was achieved through our Waypoint Talks series last fall, which included three speakers talking about constructs related to coercive control, and also interviews I conducted with each speaker from that talk. The second objective is to connect researchers and promote collaborations, and I'll expand on this in a minute about our networking event we held. The third objective is to discuss research priorities and directions with the public. So that is in the form of lay reports, which is easily accessible on our website, and through things like our talk today. And lastly, of course, is to publish our findings in peer-reviewed journal articles. So I mentioned that networking event, which really aimed at getting at that knowledge translation and scientific communication. So our plan to address this was to have a networking event with researchers that specialize in a variety of topics related to intimate partner violence that could inform coercive control from different angles and different perspectives. So these topics would include things like violence, criminology, gender and sexual minorities, and other topics as well. And the question we were asking throughout this event was, how do these topics inform what we know about coercive control and really highlight the gaps in what we don't know about coercive control? So the event itself was a huge success. I have a picture there of all the attendees. We hosted 9 speakers plus our own research team and 3 students for a total of 16 researchers from 5 Canadian provinces and the US. These were both academic and community researchers, and topics included things like sextortion, attitudes in intimate partner violence, psychopathy, facets of coercive control, and research in marginalized communities such as gender and sexual minorities and indigenous populations. So from the event, we reached 3 major findings. The first of which is that when we're talking about coercive control, we really need to, right now, focus on some descriptive studies because we need to understand where coercive control is happening, who's it happening with, and are there different types of coercive control, along with many other questions about just the nature of the act itself, the event itself, and kind of how is it happening. Second, and related, we determined that we need to move forward with a strong theoretical foundation here. And Zoe touched on this, but coercive control is a very elusive concept. And so when we're conducting research on it, maybe um, we'll have some struggles with defining it. And then even more importantly, when we're implementing it into our legislation and when we're focusing on practice, if we don't have a strong theoretical basis, it'll just make all those processes much more difficult. Our third major finding was that we need to consider different perspectives. This involves within the coercive control relationship, so people with experiences of survivorship and experiences of perpetration. This also refers to across various marginalized populations, so racialized minorities and gender and sexual minorities as well. And finally, we want to consider the perspectives of different practitioners. So, in addition to researchers, we want to get the voices of legal practitioners and social and clinical workers as well. So, here are some quotes that touch on some of those things that I mentioned, the need for lived experience voices and the need for solid definition. So, at the event, we also took some time to generate some ideas and a little timeline in the form of this mind map on the directions that we think coercive control research can go. So there's some short-term and long-term directions here. The first of which is to define coercive control. Then we may look at studying how people recognize coercive control, then understanding how coercive control behaves in different relationships and diverse relationships. Then longer term, we may want to examine the impact of legislating coercive control, and kind of an ultimate goal practically would be to train frontline service workers to best address and sorry and appropriately deal with coercive control. So that first thing that I mentioned there was defining coercive control. And after some discussion, we decided that the first piece of work we should tackle is that definition, because as I mentioned before, coercive control is a very elusive and nuanced concept. And although we all seem to collectively understand what we're referring to and what it may look like, there is some to a lot of ambiguity in the details and the nuance there. And this poses challenges when conducting research, as I mentioned, and additional challenges when we're creating and enforcing laws against coercive control. So we determined the best method to deal with this would be a scoping review. Scoping reviews are quick and effective, and we would be answering the question of how is coercive control defined in intimate partner violence literature. And this would tackle some sub-questions as well, such as are there different typologies of coercive control? What are the essential elements to these definitions? And how is that pattern, that kind of that temporal aspect of that definition structured? And this will be across academic, gray, and white literature to see how coercive control is defined by researchers and legislators. And again, this will help us understand what coercive control is, and maybe more importantly, what it is not. So setting that box around that definition on, what coercive control can look like and what is not considered coercive control. Some implications of this research project would hopefully be a consensus definition that could improve research, measurement, and assessment of coercive control, which again would make enforcing laws much easier. Now, this is only the first point we made on the mind map, and it's only one research idea. As you can see in this graphic here, that's only the first point, and we have a lot of different ideas for the future. And more so, we came up with a lot of different research needs and gaps that we thought would be important. So before I kind of turn it over to the audience and ask you some questions, I'll just read out what we have here. So we have defining coercive control and how it differs from other types of abuse, study coercive control in diverse relationships, assess coercive control and its impact over time, study the motivations of those who engage in coercive control, survey public opinions, include the perspectives of young people in research, ask open-ended questions about coercive control in police investigations, study the legal system's response to specific coercive behaviors, collect detailed criminal justice data for research, and train police in interviewing techniques for coercive control. So these are just a few ideas that we came up with, but I want to ask you all, the audience, some questions. The first of which is, do you see any ideas here that you would consider to be high priority, maybe that questions you'd like to tackle first? And I guess just putting it in the chat would be the easiest way. Some other questions to consider would be, in addition to what you would consider high priority, what you would consider maybe a lower priority, or something that you may think is less important, maybe you don't have to address right away. There's a few posts in the chat. So, yeah, defining coercive control would be considered high priority. Understanding the motivation of those who engage in coercive control sounds like an important part of research. Um, and that's very true. It's hard to understand the motivations there, and kind of enforcing based off motivations is pretty difficult. So really getting at that would be important. And yeah, the open-ended questions about coercive control would be a good way of learning about lived experience. And this would again kind of make recognizing it in practice much easier, right? I guess my last question would be, is there anything not listed here that you think would be important to research? It can be short term, it can be long term. Maybe we definitely missed some things. So any input there would be very much appreciated. Yeah, it might be good to look at why people experiencing coercive control fail to see it as such. That's something that I've thought about a lot with, we all know instances where us as a third party might look at a relationship and see it as maybe abusive or um, toxic or coercive in some ways, but really getting in there and seeing why the person experiencing it doesn't see it that way would be important. Because my thought would be that a very successful coercive controller would be one who does it so well that their victim doesn't even realize. But again, that I guess that goes back to the victim perceptions and perpetrator intentions that we really have to get at. So if there's no more, I guess, ideas right now, I'm not sure exactly. Oh, there's one. Certain life events that predispose coercive control. For example, having a child that's a couple or other life stressors. Yep, that can definitely be an interesting question to research. Is culture or religion have any effects? That would also be interesting. Of course, relationships differ across cultures and religions, so seeing how people across these different groups perceive what is healthy and what is unhealthy uh, would be a good point to make. So I'll definitely be writing these down afterwards. If there's no more ideas right now, I guess we can turn it. I'm not sure if we'll have a small discussion now or if we'll just move on to the next talk. But thank you all so much for your time and for being here. A special thank you to our other team members, Elka, Dana, and Kevin. That QR code brings you to the website with all the information on this project, including the layer report from our event and my interviews with the speakers from our Waypoint Talk series last fall. Thank you.
Okay, I think Jaden and Nikoo, if you'd like
Yep, we
to.
can get started. Okay, perfect. Um, Hi, everyone, and thanks for that really informative presentation, Dr. Hilton and Ben. I'll share my screen now. Okay, so my name is Nikoo, and I'm a part of the Our IPV Story team. I'm joined here by Jaden, who will also be doing this presentation. And today we just wanted to give an overview of this project and what we're hoping to do. We're talking about sort of where we started, how the process was, and some takeaways for other teams in case you want to take a similar approach. So we're going to be talking about our IPV story, which is a collaborative platform advancing intimate partner violence research. This is our team. We're joined today by Christy and Alnaz, but Amy couldn't make it. So just wanted to give a shout out to our amazing team. And here's the overview of our presentation. So we'll be diving deep, as I said, into the gap that we're hoping to address, some of our campaigns that we've done, the collaborations, and then finally we'll end off with a call to action. So throughout the presentation, we'll be referring to IPV or intimate partner violence as IPV. So just so that we're on a level ground there. So the gap in IPV knowledge translation currently is that the social stigma around IPV often results in the silencing of survivor voices. And this in turn results in their perspectives not being as represented in research. This is similar to other stigmatized topics in our society as well. But the difference here is that these stories can really help us develop and implement programs that could in turn help this population as well. And we see a need for virtual and in-person platforms to do this. The three things that we wanted to kind of address here were exchanging knowledge with people with lived experiences, building trust between IPV researchers and the community so that they can come forward with stories, and lastly, facilitating partnerships in IPV research. And so far, even today, we see that there are a lot of opportunities for groups to collaborate on this similar topic. So our IPV story is a platform that aims to do just that. We're hoping to create space for people with lived experiences so that they can feel empowered to share their stories. We're hoping to combine digital media and design approaches to improve knowledge translation, and we'll get to this a little bit later. And we're taking a multimodal approach, meaning that we're hoping to use social media, online events, and other modes of engaging with the community, such as in-person symposiums, just to be able to increase accessibility to our content, as well as explore different ways of exchanging ideas that might work better for our target population. One other big aspect of our IPV story is co-research, and we're really hoping to highlight the importance of co-research both for the research community and for people with lived experiences because it directly involves them in research that is affecting them down the line. And it's basically a safe platform for restoring the power of people who have experienced IPV, and it dismantles systemic inequalities that prevent them from sharing their stories. It can also help to create equitable environments where that power dynamic has shifted and where lived experiences can be used safely to inform program development. And lastly, there are several principles of core research, including autonomy, support, transparency, and co-ownership of both the process and the outcomes of the core research initiative. And you can learn more at the source that we've included here. So I'll pass it on in a bit to Jaden to discuss our online campaign, but as an overview, we're working on our website and social media. Currently, every day we're posting content and engaging with our audiences in different forms. So definitely feel free to check those out. We're also doing local and global collaborations with other groups who are working within this area. And we're also hoping to create a safe space for sharing stories. This can be both online and through our in-person events as well. So I'll pass it to Jaden to discuss.
Thanks, Nikoo. And so here, we just wanted to share the design process about how we came up with our brand. So looking at our color palette, we used the color wheel to decide on colors that reflect who we wanted to be as a brand. So with the purple color being important in IPV, and the green, which represents healing and hope. Now, in terms of our logo, we went through many iterations, beginning with the ones on the left, to finalizing our logo as the one on the right. We also wanted to take a modern approach that appeals to our audience while also keeping in mind what it is that we want to convey. So having the IPV ribbon into a pen symbolizing IPV storytelling. So here, we're looking at the 5 steps of design thinking and so how it can be applied to the work that we have done so far. So beginning with the first step, empathize, we began to try and understand the perspectives of who our audience is. And so we are looking at the general audience, we're looking at people with lived experience. We're also hoping to connect with researchers in the field and the community. The second step is define. So by understanding our audience, we began to notice and define what is currently missing between our demographic and our branding, as well as the ways in which information is being delivered. And so we are also able to define the gap between co-research and IPV. This led us to our third step, which is ideate. So the ideation of our brand and the color schemes, as well as the iterations of the logo that reflected a modern appeal. And so currently we're in between the stages of 4 and 5, which is the prototype stage as well as the testing stage. So this includes prototyping different strategies and content. And by posting these different strategies and content online, we are gaining feedback and reviewing our analytics to see what is working well and what it is that we need to work on. And also, it is a cyclical process. So this process is iterative in which we are continually trying to refine and improve our processes. So also one of our key objectives for this project is the idea of establishing relationships. So with the internet being so accessible, we are able to reach out to organizations that share similar values and goals and connect with them both online and also in person. Our online presence also allows organizations to see us and connect with us as well. And so over the past few months, we have been very fortunate to connect with amazing organizations, including AVA, the Atlas Institute for Veterans and Families, as well as Prom Glitz. And so these connections have led to online collaborations through shared posts on social media, and as well the hosting of community events, which included a dress try-on event with Prom Glitz. And so for us at our IPV story, we strive to continue our call to actions, which include continuing to post meaningful content that provides our audience with information that helps to raise awareness. Also, as well, continuing to collaborate and build lasting relationships with other organizations with similar goals and values. And also continuing to search for stories and use co-research as a driving force to create transformative research. And so with that being said, we do want to invite others to get involved and share their stories with us. So through the sharing of stories, it helps to break down the silos and build a community that creates empathy, understanding, trust, and healing. And so we would love to hear from people who have lived experience, researchers in the field, and members of the community. Sharing your story will be anonymous, and we as a team will ensure safe storytelling where all identifying information will be removed. By sharing your story, it will allow us to share it with our community, which will empower others to do the same, leading to a safe space filled with impactful and important stories. And so here we just wanted to highlight our social media. And so we invite you all to follow us on our Instagram at our IPV story to learn about upcoming events and also our collaborations with other organizations. We also do have Facebook and TikTok as well. And our handle is the same at our IPV story. And so finally, we just wanted to let you all know about an exciting in-person event. And so join us on August 17th for Storytelling for Change, a community event. During this in-person event, it is a free in-person event in which we will discuss how partnering with survivors of intimate partner violence can drive transformative research. And so this event will be held at a banquet hall in Vaughan. And during this event, you'll have the chance to network with members of the community, hear from guest speakers, participate in art and entertainment, and also lunch and refreshments will be included. So we really hope to see you there. And thank you for joining us.
All right, thank you so much, Jaden. I guess we can open the floor for any questions. We'll also put our emails in the chat. So if you have additional questions, you can get in touch with Jaden and Nikoo. Thank you, Ben. Yep, that's great. The more followers, the better. The more engagement, the better. But if anyone has any questions, please feel free to include it in the chat, or you can always email our team after. Okay, awesome. Christy, I think we are good with the presentations if we want to do closing.
Sounds great. Thank you so much, everyone, for the awesome presentations this morning. So just a few closing reminders here. As we mentioned, the recording and slides will be available post-event on the WRI website. And again, if you're able to complete that post-event survey, it does help inform future events. So we appreciate your feedback. Lastly, if you would like an attendance certificate for professional development, you can email me. My email is kallen@waypointcenter.ca, and I will help get that certificate over to you. So thank you again to all our speakers for joining us this morning. We are excited that we have another Waypoint Talks event coming up on May 13th. So we'll be joined by Rebecca Rappaport to talk about going beyond bystanders and transforming gender-based and sexual violence prevention through embedded education. So we hope to see you there. Thanks again to all our speakers this morning, and thank you to our audience for joining us. Take care.